Hello, good morning. Welcome to every members of Acharya Nidana Academy. Today we are going to have interaction with impact of Nidana in natural orifices in disease manifestation. So, before going into these particular concepts, let us know about some of the very important concepts which you need to concretize, which I used to say for each and every session. Why I am saying this particular for each and every session? Because everything can be learned and everything is teachable. And if you know about the some of the fundamentals, then every information that is being explained in Ayurveda, we can be learned it deepest understanding, or that means we can have a deep dive knowledge of any of the concept. First concept that we need to prioritize, if we know about the physics, chemistry, and biology and Ayurveda fundamentals, then any of the information mentioned in Ayurveda can be learned with the deepest understanding. Second thing, as such, when you say about the thing, that is the practice of minimalism has to be practiced continuously. Minimalism in the sense one small topic that has to be learned from the multiple angles. Let me give you an example. When you think about the dosha concept, we need to learn from the point of Rachana Sharira, from the point of Kriya Sharira, from the point of Roganidana, from the point of the Kaya Chikitsa. So like that from the point of the Rabbi or from the point of Rashastra Vaishyaji Kalpana. So that means from the multiple subjects as such, we have to look into that particular concept, then we can have the best understanding on that particular subject. The third main concept that we need to remember it is if you want to know about the concepts of Roga Nidana, then we have to learn the Kriya Sharira well. If you want to have the Kaya Chikitsa better, you need to have a Roga Nidana concepts very well. In other words, to say, learning Kriya Sharira, extending the learning into Kriya Sharira, that it becomes a Roga Nidana, and extending learning from the Roga Nidana, it becomes the Kaya Chikitsa learning. So, fourth thing, whenever if you look into this particular concepts, we need to know about pattern identification. So what do we mean by pattern identification? Pattern identification refers to repeatedly occurring observations. So, for example, if a person is continuously consuming 300 ml of the salt lassi, so continuously for a period of 10 days or 12 days at night time, so we may say that there is a possibility of increase of pitta dosha in the body, because that is considered to be one of the pitta as well as kapha dosha dominant, kapha dosha prakopaka, but which is associated with salt to some that is responsible for the increase of the pitta dosha in the body. In that particular sense, we are knowing that the person is continuously consuming the salt mixed lassi or the dadhi. That means, so there may be a possible increase of pitta dosha in the body. We need to look into the modification. That means we have to change the habit patterns. We have to change the patterns so that the pitta dominance can be minimized. That means we have to reduce the that is the intake of salt mixed lassi. So that means instead what we need to look into, what we can create, that is we can able to take the curd or the takra which is not having the salty taste or sour taste, that is actually considered to be responsible for the new pattern creation. So that means whenever if you're learning any of the concepts, try to identify the pattern identification, pattern modification, pattern creation, which is considered to be the main mottos, which are considered to be the main mottos of this particular academy. No compromise in Ayurveda fundamentals, that will be taken care. That will be taken care. And whenever if you are looking into this particular learning, follow one particular mentor. So when you are following one particular mentor from the, so that means if you are observing 3 or 4 videos of a particular mentor, you can see what is thought processes in the past, what might be the thought process in the present, and what might be the thought process in the future. So the why I am saying this one is because nowadays in this particular the internet or the information overload, we will be having millions of informations which are considered to be sometimes if you are observing all these informations, we are going into multiple directions. That means we are not going into one particular place anywhere. So that is the reason. So when you want to have the proper learning, follow one particular mentor. And so when you are learning the language of Ayurveda, you have to learn from that particular point. And when you want to learn the Western information, learn from that particular point. Try to bridge these two informations at regular intervals. If it is possible for you to bridge these information at regular intervals, then we are going in the right direction. So this is what the we are going to discuss today. Some of the important informations where we are going to bridge these two informations in multiple levels. And the next one is learning Ayurveda. That has to be learning like a new language. So what do you mean by learning a new language? New language refers to, we want to learn new language. Most commonly used words that were dealt first, then less commonly used words, then less commonly used words, less commonly used words. Like that, in Ayurveda also, most frequently used words that has to be learned better. Then next, less used words, then less used words. In that way, so we been able to learn the Ayurveda also. When you think about the most commonly used word is Nidana or dosha. So like that. So when you look into that particular point, so learn that particular angle. Most of the occasions you may feel difficulty in that particular sense. So how look into that? That means where you are stucking, where you are already stuck, from that particular part itself, start learning. That's the best way to have a learning the any of the new subject as such. So before going into this particular concepts, we need to know the some of the concepts that is considered to be Stirling forces concept that has been discussed in the earlier videos. If you want to have those informations, go to the earlier videos. Then sludged blood concept. In the sixth, what do you say that the 6th January 2024, there was a live video session in that both Stirling forces concept and sludged blood concept that was being discussed. And even in my earlier recorded videos, which are present in the YouTube, in the of the Acharya Nidana Academy, we are having these two concepts also. Roga Marga concept. This is considered the first video that I have uploaded, but because of unavoidable reasons, the voice is not audible. So that's why I have created this Roga Marga concept applied aspect again repeatedly. That was being posted in this particular video there, in this particular channel. Next, that is manifestation of disease. Most of the occasion, the manifestation of disease starts from Abhyantara to Bahya Roga Marga, or otherwise Abhyantara to Madhyama Roga Marga. And the next one, that is the entry of pathogen in the srotas. So wherein the while discussing about the srotomula, this was being discussed. So you need to look into these different points before going into the this further sessions as such. Now, why? So this particular natural orifices and impact of nidana and disease manifestation that are essential. Now, when you look into the natural orifices, the natural orifices, in the sense, most of the occasions, the etiological factors they enter through these natural orifices only. In one or the other way, that may have an impact on the total body disturbed functions. Thereby, there is a possibility of disease manifestation. So, coming to the natural orifices, Ayurveda says 9 different orifices they are present in the males and 12 orifices are present in the females. So 9 orifices, that is the one mouth, 2 eyes, 2 ears, 2 nostrils, that is in the upper part, and the breast as well as vagina in case of females. Each are having their own significance as far as disease manifestation is concerned. So why this particular this is very very important when you look into the source of entry of pathogen. When you think about source of entry of pathogen, so that means, so when a person, let us look into the present day. So we are in the cold season. So that means the entry of pathogen. So that means when you look into that cold air, that is considered to be entering into the body by, think about the nose, mouth, eyes, ears, etc., and even urethra as well as anus. They are going to be exposed to this particular cold air. When you look into that, in the nose, if that is entering, that is leading to the respiratory nasal mucosal dryness. So whereby there is every possibility of warming of the air that is going to get affected. When there is warming of the air is being affected, so naturally, so that is lead to the dryness of the, what do you say that, the respiratory mucosa. When you look into the exposure of this cold air in the mouth, that is responsible for the reduced secretions to happen in the mouth. So thereby the person may have the again the if a person is taking cold food substances, that is even responsible for the reduced secretion to happen in the stomach also. So then stasis of the pathogen in the body. When you think about stasis of the pathogen, when you think about the whole alimentary canal, the stasis of pathogen will be taking place for a longer time in the stomach, small intestine, and large intestine. So, whereas in the mouth, there is a possibility if a person is not performing proper oral hygiene. Entry of pathogen into the other tissues. For this, you need to look into the my first live stream video. So in that particular session, it was being discussed regarding the entry of pathogen if it happens in three different locations, how that will be resulting in the disease manifestation that was being highlighted there. Now, when you think about the concept of Rogamarga, so in brief, I'm going to discuss about it. So, what do you mean by concept of Rogamarga? When you think about the Roga in the sense, the any kind of the disturbed function is going to take place. Marga in the sense wherein all these particular pathogens, there may be a possibility of doing a dysfunction, and how to identify exactly where this particular abnormal function is being located, that has to be considered, that is what is considered to be the marga or pathogen or the pathway. Before going to this particular concept, we need to know about the gut transit time. What do you mean by gut transit time? Gut transit time is nothing but the movement of the food substances happening in the alimentary canal. When you look into that, the mouth as such, there may be a possibility of the stasis of the food at least for a period of 2 or 3 minutes by looking into the what is a mastication, etc., etc. So that food may be remaining in the mouth for a period of 2 or 3 minutes. Whereas in the esophagus, there will be rapid movement of the food substances going to take place. That means within seconds that will be moving from the mouth to the stomach. In the stomach, the food may remain for a period of 2 hours. So, because the pylori canal will be closed, so immediately after the food entry into the stomach, so which is in turn is responsible first, and in the large intestine, the food may remain in the for the large intestine for a period of they are moving from mouth to large intestine. When you look into the entry of food substances in the mouth, they will be usually macromolecular substances. And you look at macromolecular substances, so they are considered to be not in a position to getting absorbed from the body, absorbed into the body. So that has to be properly converted into intermediate molecules in the stomach, or it has to be converted into micromolecules in the small intestine as well as in the large intestine. Then only there will be a possibility of entry of these food substances from the capillaries of the stomach, small intestine, large intestine into the vascular compartment. From there, these nutrients will be entering into the liver. From there, it will be entering into the heart via hepatic veins. From there, it will be entering into the heart, that is by inferior vena cava. From there, it will be entering into the aorta to the different parts of the body. So when you look in this is what is considered to be the mechanism of movement of the food substances from the mouth to the intravascular compartment. From there, these capillaries, these nutrients will be moving into the interstitial compartment. From the interstitial compartment, that will be moving into the cells. From the interstitial compartment, these nutrients or oxygen, etc., that will be moving. When you look into the movement of the pathogen, it will be occurring in the same way. So when you look into the mouth, is considered to be having a millions of our microorganisms. From there, that will be entering into the stomach. As the food substances, they may remain in the stomach for a period of 2 hours. So that means there is a possibility of proliferation of infection. And when you look into the proliferation of infection, why infection will be happening in the stomach? Because most of us are consuming carbohydrate rich diet. When there is consumption of carbohydrate rich diet, naturally the microorganisms which are entering from the mouth, they are going to get proliferated in the stomach. When this is proliferation of microorganisms that is happening, that is responsible for the inflammation of the stomach. So when this inflammation of the stomach will be happening, what actually happens is that will be responsible for the damage to the gastric mucosa. When there is damage to the respiratory mucosa, alimentary canal mucosa or the gastric mucosa is happening, so that is leading to the transfer of macromolecules into the intravascular compartment. From there, it will not be entering via the what do you say the intravascular compartment into the liver, that will be entering via lymphatics into the blood circulation. This is the why they are not entering into the liver, because they are macromolecules. So then comes the small intestine. That means the same way the mechanism will be happening even in the small intestine as well as large intestine also, if macromolecules are being moving into the small intestine, large intestine. Now when you look into the here there is a question, why dosha accumulation starts in the stomach, small intestine, large intestine, why not in the stomach and esophagus? That means when you look into the answer itself is being given in the gut transit time. In the stomach, the food may remain for a period of 2 hours. In the small intestine, the food may remain for a period of 6 hours. And in the large intestine, the food may remain for a period of 24 to 48 hours. So, as we are consuming carbohydrate diet, there is every possibility of infection or inflammation to increase in the stomach, small intestine, large intestine. Whereas in the mouth, is there any possibility of some kind of infection to happen? Yes, but the thing is, this happens because of poor oral hygiene. There is the foods, they will be remaining in the areas near the teeth, in between the gums, which are considered to be again responsible for the proliferation infection to happen at that particular time period. But that is not causing the what do you say that dosha prakopa as that happens in the stomach, small intestine, large intestine. Then the why esophagus is not a place for the breeding mosquitoes or microorganisms? That is because the movement is happening within seconds. So that's why there is no question of a proliferation of infection to happen in this esophagus. That may happen in cases of any obstruction takes place in the esophagus, such as cardiospasm or the carcinoma of the esophagus. So now regarding the natural orifices and location. So when you look into that, most of these they are considered to be, in case of males, 7 are present in the head and neck. That's what we have discussed earlier. 2 in the eyes, 2 in the ears, and 2 in the nose, and 1 in the mouth, and 2 are in the lower abdomen, that is the urethra as well as anus. Whereas in case of females, 7 are present in the head and neck, as we discussed earlier. 2 are present in the middle part, that is breast tissue, and 3 are in the lower abdomen, that is anus, urethra, and vagina. When you look into the quality of this particular Shitaguna quality, let us give an example. Shitaguna quality in different orifices. Earlier we have discussed something related to the nose and the mouth. Now look into the ears. So these Shita quality, they are going to enter into the ears, so which may sometimes lead into dryness of the wax being accumulated there, which is again responsible for the conductive type of deafness. And another way of this, so wherein ear may be afflicted, it could be the person may be breathing any kind of the what do you say that the cold air, which is again responsible for the sometimes blockage to happen in the eustachian tube, which is again responsible for the uh, accumulation or the removal of air in the middle ear. Why? Because there is a connection between the middle ear and the nose. As that's oxygenate that is going to get utilized by the surrounding tissue that's responsible for the shrinkage of the middle ear. That's how the person may have sometimes ear pain in the ear, which is again responsible for the, what do you say, that conductive type of deafness. When you look into the presence or this eyes and its impact on the, what do you say, that the uh, Ikshita guna, the cold air, the person may have sometimes, the person may have the irritation or itching towards the eye, or the person may have sometimes burning sensation of the eyes. Sometimes, because of the nasal obstruction, the person may have the, what do you say, that the backward movement of the secretions from the nasolacrimal duct into the eyes, which is sometimes responsible for the closure of the eyes, specifically in the early morning time. This is specifically seen in children who are having the respiratory infection there. Then, when you look into the when you look into the anus, that will be contraction of this anus will be taking place, and the person will be having the poor intestinal motility. In case of urethra, that will be closed, urethral sphincter that will be closed. That is the responsible for the stasis. That is the responsible for the uh, stasis of the, that is the stoppage of micturition at that particular time, or otherwise the person may have the prolonged micturition. That is, he is going to do the micturition for after a longer time. Now, regarding the importance, why the mouth, I am going to discuss about the concept of the natural level in terms of the mouth itself. This is the main motto of today's discussion. When you look into the why it is very important, because rogaha sarvepi bande atno, it is being said. That means all the diseases are considered because of improper digestive fire. When you look into that, first of all, the macromolecules, as we have discussed earlier, all the substances that we are going to consume, they are in the macromolecular form. So that means they are not in an absorbable form. They are in an inabsorbable form. They are going to get into the converted into absorbable form in the small intestine, and even from in the large intestine also. Large intestine and small intestine, they are responsible for the absorption of these micronutrients or micromolecules, whereas from the mouth till the stomach, they are in the usually in the macromolecules form. So that is the sucrose, or otherwise starch, etc., or otherwise the proteins, etc. They are usually, when they are going to enter into the stomach, they are usually in the non-absorbable form. Similarly, the pathogens, they are going to enter via mouth. So that means, so rogaha sarvepi mande agno. That means which is responsible for the impact of the, what do you say, that the entry of these will be taking place from the mouth itself. So when you look into the further aspect regarding the concept of Agni-mandya, so here why Agni-mandya will be happening there? When you think about it, so the person will be consuming the food, so that is the, there are different varieties of, what do you say, that the abnormal diet pattern, adhyashana or vishamashana or samashana or viruddhashana, etc. When you look into that, so that is resulting in the inflammation to happen in the in the stomach. When there is inflammation is happening, and when a person is doing adhyashana, etc., what actually happens is the person is frequently consuming the food. So that means the macromolecules, they are entering into the stomach for longer, for entering into the stomach, and that may stay in the stomach for longer time. As we have discussed earlier, the food may remain in the stomach for a period of 2 hours. If a person is doing adhyasana, the earlier the food consumed earlier that may remain for longer time. So that is, they are going might have converted in intermediate molecules. These intermediate molecules, they are being present in the stomach, and when a person is taking new food, they are in the macromolecular form, which are considered to be heavier in the molecular weight. They are going to displace these the intermediate molecules or macromolecules to the periphery. So thereby, these newly consumed food substance, they may attain the uh, they may get stored near the pyloric antrum, and this is actually responsible for the dilution of a hydrochloric acid. When there is a dilution of hydrochloric acid is happening, so that is responsible for the inactivation of a pepsinogen, the into pepsin, which is very essential for the conversion of macromolecules into the intermediate molecules. When there is this are usually carbohydrate rich, which are responsible for the pathogens to get proliferated, or microbes are going to get proliferated, which is leading to inflammation or infection to happen in the stomach, which is responsible for the damage to the damage to the gastric mucosa. When there is damage to the gastric mucosa is happening, macromolecules which are being present in the wall of the stomach, they are going to get enter into the interstitious tissue of the stomach. When they are going into the interstitial tissue of the stomach, they are going to enter into the lymphatics rather than liver. Why? As they are macromolecules, they are not in absorbable form into the liver. They are going into the lymphatics. From there, it will be entering into the uh, that is junction between the left internal jugular vein and left subclavian vein through thoracic duct. From there, it will be entering into superior vena cava and enters into the heart, superior vena cava, right atrium, right ventricle, pulmonary capillaries, left atrium, left ventricle, then aorta, then different parts of the body through the arterial system. So that means, so this is how this will be bypassing the liver, that will be entering into the heart. Clear? So now, what actually meant by the concept of sama and nirama? When you think about it, so this one we have discussed earlier, adhyashana, vishamana, samashana, and viruddhashana. So the source of entry will be through the mouth. From there, it is responsible for the Agnimandya. Agnimandya refers to diluted hydrochloric acid secretion, inability to convert into pepsinogen. So this is happening into the pepsin. And third thing, damage to the gastric mucosa, that will be happening. So these are the functional derangement that may happen in case of Agnimandya. So which in turn results in macromolecules to remain as macromolecules due to inactive pepsinogen and the dilute hydrochloric acid, and conversion of these macromolecules into the intermediate molecules will not be happening, and if at all that happens, that may happen partially. So because of the some amount of the pepsin might have happened converted into pepsin, that means partial intermediate molecule that may be happening. Because of that, so that will be moving into the, so these intermediate molecules due to the adhyasana, that will be moving into the periphery. Newly consumed food substances, they may come to the pyloric antrum first. That means these molecules, intermediate molecules or macromolecules consumed earlier, they may move to the periphery. So that means until and unless these consumed food substances, they may move into the duodenum, they are not coming into the picture into the duodenum. So these earlier consumed substances, they are not coming into the small intestine. That is why these substances, they are moving first and these macromolecules, they are moving next. So that means when you look into that, these are heavier molecules which are being present at the stomach wall. They are moving in the small intestine in the same way. That is what is considered to be the movement of these heavier molecules. They move at the periphery. Then comes the lighter molecules. They will be coming at the uh, near the center, and at the center the lightest molecules, they are moving. So this is what actually happens in cases of even in the large intestine or small intestine also. So this is how, this is an image that is showing whenever the slow moving vehicle is there, the fast moving vehicle that will be bypassing this. In the same way, this that is the reason these heavier substances, they are moving at the periphery. So that means these are not responsible for the secretions of the small intestine as well as in the large intestine to happen into the, what do you say, that the into the small intestine as well as into the large intestine. So that means again these macromolecules which are present in the small intestine, they remain as macromolecules or intermediate molecules. They are moving from the stomach to the small intestine, then to the large intestine as macromolecules only. So that is how these secretions, they are not coming into the small intestine. This conversion of macromolecules, they are not being converted into intermediate molecules or macromolecules. That's how they are responsible for the, what do you say, that the improper digestion itself. In other words, to say, any of the contents which are present in the stomach for longer amount of time, they are usually considered to be sama kapha as such. When you look into the same concept that are being present at the small intestine, these macromolecules, etc., they are going to be considered as the sama pitta lakshana. When you look into the same mechanism that happens in the large intestine, that may lead to sama vata lakshana. So when you look into the Samapitta or Samavata, when you look into that, as we have discussed, the macromolecules, they are being present on the side of the small intestinal wall or large intestinal wall. So that will be leading to, as we have discussed, reduced secretions to happen in the small intestine, large intestine, which is again leading to mucosal damage to the small intestine and large intestine, as we have discussed earlier. Why? Because the carbohydrate rich diet which are moving in from the stomach into the small intestine and into the large intestine, and they are responsible for the proliferation of the infection to happen even in the small intestine or intestine. Thereby, these macromolecules are not in a position to be get converted into intermediate molecules or micromolecules. Thereby, these macromolecules, intermediate molecules, they are going to get enter into the interstitial space of the small intestine and large intestine. Thereby, that will be entering into the lymphatics. From there, it will be entering into the thoracic duct. From there, it will be entering into the junction between the left internal jugular vein and subclavian vein. From there, it will be entering into superior vena cava, into the heart. From the heart, it will be moving via the arterial system. This is what is considered to be the concept of a sama kapha or sama pitta or sama vata. When you look into the other aspects regarding the nose, as continuing with the other natural orifices, entry of cold air, specifically, that is going to get responsible for the dryness of the what do you say, that the nasal mucosa. Then dust, which is again responsible for the sneezing, etc., or cough, etc. Smoke, that is responsible for the again sneeze or cough, etc. Foreign body, specifically observed in cases of children, they are going to have abnormal or abrupt onset of cough, etc. That is going to get happened. When you look into that, the nose is having several barriers to prevent the entry of these dust, smoke, etc. into the distal parts of the respiratory passages, such as hairs in the nostrils, or nasal turbinates, or mucus in the nasal cavity, and then cilia present in the nasal cavity, then mucus in the lower respiratory tract, and cilia present in the lower respiratory passages. So these are the different barriers which are responsible for the prevention of dust, smoke, etc., or foreign body that is happening to prevent this from this uh, to prevent into the respiratory passages, so that the person may have a optimum, what do you say, that the respiratory function. Another major thing that is being considered to be one of the major, what do you say, that the reason for most of the respiratory conditions as such, most of the people in India, they are spit out the sputum in the open space. This is being observed most of the occasions in most part of the India. When this is happening, the people who are doing specifically doing the cleaning work of the street, they are more prone to have inhalation of these respiratory droplets, which is going to the nose. Thereby the person may have an affliction of a respiratory infection, respiratory disease that may be occurring there. When you look into the eyes, when you look into the eyes, the contact of dust, cold air to the eyes, which is responsible for the burning, sorry, itching sensation for the specifically for dust, and burning sensation to happen when this cold air is touching the eyes. And another major thing, the nasolacrimal duct obstruction, specifically observed in children due to the nasal blockage, they are going to have the affliction of, that is the entry of these the secretions into the eyes. So thereby in the early morning, the children, they may have closure of the eyes. And another major thing, in cases of improper closure of the eyes, which is considered to be mainly observed in case of Bell's palsy, one of the frequent observed condition in case of the Ayurveda hospitals, and even myasthenia gravis is another condition where the person may be having the inability to close the eyes as the person is doing the exercises, myasthenia gravis. In these occasions, eyes may be affected there. Ears. When you look into the ears, the entry of cold air that is happening, which is again responsible for the wax to get dried up, and sometimes foreign body insertion. Some persons may pierce the pen or etc. some other pointed objects, so which may sometimes damage the, what do you say, that the damage the tympanic membrane. So middle ear infection that can happen when there is the eustachian tube obstruction. So here the naturally the route of entry of pathogen will be through the nose. Plus high decibel sounds, which are considered to be damaging the ears. So that means it need not be the physical, that is the mechanical causes as such. Sometimes even the sounds where in a that is which are invisible, that may damage the ears also. Then regarding the anus, so that is the insertion of nozzle of any macan, one, and anal intercourse, which is considered one of the sexual perversion. Then insertion of the foreign body without proper precaution in case of proctoscope, etc. So that is one of the, what do you say, that the uh, route of entry of the pathogen may happen there. Urethra, catheterization, so that is the retention of urine that may happen, that is the, which is concerned of the foreign body itself, which is responsible for the specifically used in cases of retention of urine as such. So altogether the take home messages from today's discussion are: all etiological factors are in one or another way enter the body through either one or more natural orifices. Shita quality, when you look into that, that may enter via your, what do you say, that the mouth, via nose, via your eyes, ears. So thereby, when you look into the exposure of this anus and urethra, that is responsible for the constriction of these sphincters. So which in turn results in the uh, what do you say, that disease manifestation may be possible. And this is the thing, earliest symptom will be considered to be related to the organ which are nearer to natural orifice. If a person is having the entry of this particular Shitaguna quality from the nose, the earliest symptom we are going to observe in the nose itself. If the Shita is entering into the ears, the earliest symptom we are going to observe related to ears itself. And if it is entering via nose, it is related to, sorry, eyes, it is related to eyes itself. That is why, that is what is considered to be earliest symptom will be related to the organ related to the natural orifice. While analyzing the symptom, you have to look into the surrounding of the environment that has to be considered. And last but not the least, Samprapti Vigatana is considered to be the main motto of any health discipline. Thank you for patient hearing. So, if you have any doubts as such, then let us have the uh, discussion now.